I hope you all are doing great and not stressing a lot for your exams. Today, let's talk about pediatrics, all the important topics and the resources for each topic I'll be telling here. And I'll try to keep it short, but probably gonna make 2 videos for pediatrics because it's, a lot of topics to cover. So let's begin. First is, what are the 3 main resources to study pediatrics from? I would say KAPLAN, John Murtagh, and RCH. That's it. These 3 are the main resources. If we talk about neonatology first, then respiratory diseases for neonates are very important. Transient tachypnea of newborn, respiratory distress syndrome, meconium aspiration syndrome, all 3 and their differences, how their X-ray presentations are and how they clinically present, how to manage them, what are the different gestational ages when they present. These 3 diseases you can cover from KAPLAN, and I think they're good enough. You will be having good summarized version of these in KAPLAN. By KAPLAN, I mean USMLE Step 2 lecture notes, the CK notes for pediatrics. There are for every module and every subject. You can, like today we are talking about pediatrics one. So the first chapter or second chapter has these newborn diseases. You can do this from there. If we talk about other newborn things, then that will be diaphragmatic hernia, omphalocele, gastroschisis. All of those are in that chapter 2 in the KAPLAN. Another important neonatal topic is jaundice in newborn, neonatal jaundice. That I would say you should do from KAPLAN as well as from RCH. RCH has a good guideline for it, and I'll be linking all the RCH important guidelines for pediatrics down below, so don't worry about that. But give it a read from RCH. It has a good summarized version of neonatal jaundice, and you should be really able to differentiate what is physiologic jaundice, what is pathologic jaundice, and then when do we call it conjugated, unconjugated, their causes, ABO incompatibility, and the non-immune jaundice types. Also, you should know breast milk, breastfeeding jaundice. So it's important to have a good understanding of newborn neonatal jaundice. There are infections like torch infections, also cytomegalovirus, rubella infection, varicella, herpes simplex. Their presentation, there are these things to memorize in these diseases, like what the baby gonna get, and that's present in KAPLAN 2. There's this is the same chapter which is neonatal jaundice. In continuation, you will get these neonatal sepsis. Under the heading of neonatal sepsis, you'll get these infections. Just give it a read and memorize the important findings in these presentations, like disease presentations, like rubella. What are you gonna get in rubella? What are you gonna get in cytomegalo? They can give these questions. They do give these questions, that how is rubella, like they'll give the findings and then they'll ask you which newborn infection is this. Okay, then there are congenital heart diseases, all obviously very important. The cyanotic and acyanotic one. The important acyanotic ones would be ASD, VSD, coarctation of aorta, patent ductus arteriosus. These 4 I would say. And in the cyanotic ones, transposition of great vessels and tetralogy of Fallot. In tetralogy of Fallot, you should know what that spells, how to manage them. Okay, they do ask questions from that. Also, what is hypoplastic left heart syndrome? That's also very important, and that's a cyanotic presentation too. Other than that, you should know what's innocent murmur, how to differentiate this innocent murmur from these heart diseases murmur. And innocent murmur is a very favorite topic. Try to read it from John Murtagh and KAPLAN both. Otherwise, all the cyanotic and acyanotic congenital heart diseases will be enough from KAPLAN. Okay. Now I will be talking about the pediatrics important topics in stepwise fashion. Like we will talk about respiratory, cardiovascular, and neurology, in every system for pediatrics, which topic is important in which system. Let's begin with respiratory system. Okay, there are majorly 10 important topics that you could see in the list. I would say that pneumonia is very important topic for respiratory system. RCH has very good guideline for it. And what you should be knowing is what is mild, moderate, severe pneumonia, how you're going to manage them, which different antibiotics you're going to give in like which type of pneumonia. Also, when to admit the child, when to perform an x-ray, when to think of an effusion, what is the difference between effusion and consolidation, and how to manage them, when is the time to drain the effusion. All of these things are important related to pneumonia. And for adults also, I think you should be doing both simultaneously. If you're doing pneumonia, maybe you should do the adult one beforehand, then the pediatric one, but it's up to you. Do read RCH guideline for pneumonia. Then there is another important topic, asthma, obviously, and there is a good guideline in Australia for asthma. It's for adults or children, for both. It's very good. It's called asthma handbook. That is proper Australian guideline to manage how to manage asthma in different phases, and you should at least be doing the charts, important charts from that. You should know what's mild, moderate, severe asthma, what's the different managements, when to give preventer to a child, when to diagnose asthma, and at what age is it present, what preventer is given in what age. I'll try to link it down below as well. There is a chapter in John Murtagh called Childhood Emergencies that has very important topics overall. I'll be telling the important ones for each system when we'll be talking about that system. Like for respiratory, it has 3 important topics: Croup, acute epiglottitis, bronchiolitis. You should read these topics from John Murtagh, that chapter that I'm just at the name, like children or childhood emergencies. And you should do these from RCH as well. RCH has guidelines for all these, and they're very good. You should have very good understanding of these 3 topics, as you know that they are very important childhood emergencies and childhood presentations for respiratory system, and you should not miss them. How to manage them, when to attach oxygen, these all are very important things about these. Like acute epiglottitis, what are you going to do for it, when are you going to intubate? For bronchiolitis, when are you going to give oxygen, when are you going to give more oxygen, high flow oxygen, and otherwise it's conservative management, you're going to do nothing. Or for Croup, what nebs you're going to use, what dosage of adrenaline you're going to use. You should know the dosage of adrenaline. Okay, AMC is not going to ask you any dosages, but adrenaline dosage they're going to ask you. Okay, and corticosteroids when you're going to use for Croup. All these things are important. I'll be linking all the important RCH links for these 3. Okay, there is Quinsy also. There is a guideline in RCH with the name of sore throat. Okay, and that has all the differential diagnosis of sore throat and their presentations. AMC do give questions from their guideline. Do give it a read. Okay, and there is a guideline for angioedema and anaphylaxis too. That's important. They want you to know that as well, and I'll be linking that down below. Anaphylaxis, again, you should know the adrenaline dosage and what comes first in anaphylaxis management, how you are going to manage a case of anaphylaxis. You should know that. Angioedema as well. Angioedema, they do ask questions from angioedema. People do miss this topic, but I have seen many times question coming from it. In my exam, I got a question from angioedema as well. 2 other important topics I would say for respiratory would be breath holding attacks. They want you to know those. I will be linking an RCH link for it, and you should read it from John Murtagh as well. It's there. Also, you should know about foreign body inhalation or aspiration. What to do, what are the steps, when are you gonna start which maneuver. So when are you gonna start performing the surgery, all of that. There is a chart, very good chart in RCH. You can just give it a read. Also, it's present in John Murtagh as well. Foreign body inhalation, foreign body ingestion, both are important. Both have different RCH guidelines. You should give it a read to both of them. Okay, I think that's it about the respiratory system. But if I think of any other topics that come into my mind, I'm gonna put it in the list. And you can also do other topics that are gonna come in the recent recalls. Do not forget to do them as well. Okay. IT, esophageal atresia, duodenal atresia, pyloric stenosis. These are important topics. You can read this from KAPLAN. And then there is constipation. It's important. You can have a good RCH guideline for it. It's available online, and I'll be linking as well. Then there is encorpesis. It's important. It's AMC's favorite topic. To give it a read from RCH. Also for GIT, important ones will be Hirschsprung disease, intussusception. For intussusception, there is a good RCH guideline again, and Hirschsprung, you can give it a read from KAPLAN. Or there is also Meckel's diverticulum. That you should know as well. What is Meckel's diverticulum? Its presentation. The important thing for GIT is gastroesophageal reflux and gastroesophageal reflux disease. Okay, they want you to know the difference between both of them, and then there is a good RCH guideline for it. You can read it, and it's very helpful. It's their favorite topic as well. For renal system, there are only few important topics. One of them is UTI. You should read it from RCH. RCH has very good guideline for UTI. Also need to remember the scans, like when to do ultrasound, and then when to do DMSA, then when to diagnose with echo ureteric reflux, when to do MCUG. All of these you need to know, and that's present in the RCH guideline for UTI. For other than that, you need to know glomerulonephritis, nephrotic both. There's a guideline for nephrotic only. For nephritic, you can read KAPLAN. Just need to know basics for it. Another topic is enuresis. Nocturnal enuresis. They want you to know everything about it. Okay, and I'll be giving a link here. It's present in John Murtagh also, but RCH has a good summarized version of it. You can give it a read from there. That's it about the renal system. I think that's it for this video also. It's getting a little longer. I'll be talking about few other important topics for pediatrics in the next video. See you soon. Bye bye.